Welcome back. This is Friday lunchtime. We'll have regular response and analysis to the crime statistics on the channel throughout the course of the afternoon. But I want to move now to the COVID corruption cesspool that we find ourselves in this week. Ongoing reports of alleged corruption in government, specifically in relation to the provision of medical supplies as a result of COVID-19 are, and I quote, deeply unsettling and pose a threat to the provision of proper medical care to patients. Those are strong words from the South African Medical Association. Dr. Angelique Coetzee is the chairperson of the organisation and is rightfully angry about this issue. She joins us now on Friday lunchtime. Doctor, good afternoon to you. You say that this is a threat to the provision of proper medical care to patients. Explain that, if you would, in greater detail.
Yes, thank you. Good afternoon to everyone out there. Yes, this is really a threat to the doctors' own livelihood, their own security of how they can make sure that they are fine when treating patients suffering from COVID disease. You have to understand that a lot of these protective gear that is of inferior quality or which has been getting through levels that was not acceptable in a procurement process. These PPE are being used or wear by doctors in an ICU or in high case settings where you know those patients lying there are extremely sick. We've always said that the patients in those wards, 6% of them will be admitted in an ICU, of which 6% or half of them will then in the end die because of the complications of this virus and the virus itself.
Right. Dr. Coetzee, I wonder if I can ask you to give me a very blunt answer to this question. As a result of this corruption, do you think that there is a greater chance now of people with COVID-19 losing their lives? In other words, dying?
Yeah. Yes. Healthcare people. Not so much the patients as well, but the healthcare workers. Yes. I think it's criminal to supply a PPE that is of inferior quality. And I think that Osama would like to see that those people selling those type of inferior quality of PPEs being criminally prosecuted. This is nothing less than murder at the end of the day. If I'm wearing gear that I think is going to protect me and the patients around me because I might have it underlying and not knowing it, and then treating patients who's under investigation, and I can give it to them.
Doctor, by all accounts, you're not happy with the way that this is being handled officially. Your organisation says recent anti-corruption sentiments from the President, and I quote, remain hollow without meaningful, transparent and visible action, particularly from the highest office in the country. Is government simply not having a proper grip on this?
I don't think they've got a proper grip on it because, again, Osama said many times, politicians should stay out of the healthcare. Healthcare is for healthcare people. We as the healthcare fraternity should be able to say what needs to be done, how it needs to be done. But there's too many political interference in this. And again, we are very happy to see that the MEC of Gauteng and his wife and the spokesperson of the president's been now put on to 4-week suspension. But as been proven before to us, even with the banking scandal, you can be put onto a disciplinary process and waiting for that to be finished. But you can come back and nothing happens. And this is the problem in this country, that people, especially the higher you fly, the less you are getting burned. It's actually the worst thing. You should have been burned the most, but not in our country. So even if you put them on suspension, the proof is going to lie in what happened afterwards.
Dr. Coetzee, patently you would be or should be engaging with government. What promises are you being made, if any at all?
Well, we have spoken with the National Department of Health. We have made it clear that we need to work together, especially in two fields, around the corruption fields, or as what we're getting from our members, but also we have started a whistleblow project. And what we have seen there is our doctors complaining about lack of water in certain hospitals. The fact that there's not enough doctors, especially Pelonome Hospital in the Free State, in the Opsenbani department. How can you have one registrar? This has been escalated to the Provincial Department of Health in the Free State. Nothing has been done because there's no accountability. So I don't need to do anything because someone else will either do my work for me, or if I keep on quiet long enough, the problem will go away because the doctors will give up fighting. But it's unacceptable. So there's no accountability. Where is the accountability?
Dr. Anjali Kutsia, thank you very much indeed, Chairperson of the South African Medical Association.